Hi, I'm Dr. David Matlock, and I'm a cosmetic surgeon here in Los Angeles. Today we're going to go over the frequently asked questions for illegal injections. What is a biopolymer? A biopolymer is a legal product approved by the FDA for injection into the body. These products are collagen, hyaluronics, and Sculptra. I think it's very important to understand in regard to a biopolymer and illegal injections. Biopolymers are legal, but you have to be a physician to be able to purchase these products. So an illegal injector cannot get these products, although those illegal injectors may tell you it's a biopolymer, trying to connote that it is legal, but it's not. They can't get those products. Only a licensed physician can get those products. Why do people remove biopolymers? If you hear of a person who has gotten a questionable biopolymer, it isn't a biopolymer. Basically, these are illegal substances such as silicone. The injectors, I see it day in and day out. A patient came in and they said, well, I have biopolymers. The injector said it was biopolymers, but it's not. It's illegal. It's important to understand that. What are foreign body substances? A foreign body substance in this context is something injected into the buttocks and is creating a reaction or problem, such as scars, scar tissue, a nodule, or something that's the size of a baseball or a golf ball or a marble. From which areas of the body can biopolymers be removed? You can remove biopolymers, meaning hyaluronic acids, from anywhere in the body that they have been injected. We can use a hyaluronidase to dissolve it. How is lipo used to remove silicone injections? Lipo is used to remove silicone injections via a manual removal by breaking up the tissue and the product and suctioning it out. What methods can be used to remove silicone from the body? Well, basically it's two methods that can be used. You can use a more aggressive, which is cutting across the top of the buttocks, or even up underneath the buttocks and directly, physically removing the product as much as you can. Or, depending upon the nature of the product and the reaction of the body, it may be softer and you can remove it just via a small incision up under the cheek and suction it out, break it up and suction it out. It's important to understand that no matter what technique you use, you can't get it all out. You can get the majority, but you can't get it all out. What are the negative consequences of having a silicone injection? The negative consequences of having silicone injection, it can migrate, it can cause discomfort, pain, disfigurement, and even a discoloration of the skin. In extreme cases, you can even have death or dissemination of that product inside the body, elsewhere, to the legs, even to the lungs. What are the common symptoms associated with silicone or illegal injections? The common symptoms associated with it is disfigurement, asymmetry of the buttocks, discomfort of the buttocks, pain of the buttocks, and dissemination to other parts near the buttocks, such as the outer thighs and lower thighs. Are the foreign bodies eliminated at 100% rate? The foreign bodies are not eliminated at 100% rate. I tell patients, visualize this. You have a bucket of water, you have oatmeal, you throw it into the water, now pick every bit of it out. You can't. That's an analogy of when you have the silicone injected. That's why you really should not have these products injected into your body. No matter what procedure or approach that you use, a more aggressive or more conservative, you cannot remove all the silicone from the body. Will my skin return to its original condition? Well, it really depends upon the nature of the assault, I would say, on the skin. Some patients just have some effects of normalization of the skin or the contour or the texture, but a lot of times if it's a severe hyperpigmentation or the skin is more like leather or something like that, it won't return to normal. Can every patient be treated by a small infragluteal crease incision to remove the illegal silicone? Every patient is different. Those patients who can be treated with a small infragluteal crease are those patients where the buttocks overall is soft and where We don't have lesions such as hard areas, fibrous areas, areas like boards, golf balls, baseballs. Those areas, or those types of patients, may have to have the traditional open procedure where you cut straight across the upper part of the buttocks. Otherwise, on the more milder cases per se, we can use a very small infragluteal crease, use the vaser to help break it up, and then suction that product out. Who are the right candidates for silicone injection removal? Well, it depends upon what the effects of the silicone has on the body. If the buttocks overall is smooth, if the buttocks overall is soft, then it is amenable to being removed from a small infragluteal crease. But if you have areas that feel like a board or a baseball, golf balls, multiple areas like that, then you may have to go more with a traditional direct incision at the top of the buttocks throughout the entire length of the buttocks to open and remove that way. What are the benefits of silicone injection removal? The benefits of the removal is to help to reduce or eliminate problems that patients may have of the firmness or hardness or the irregularities of the buttocks, and to bring the buttocks into a more normal contour and help to prevent further complications from that material, such as discoloration of the skin, irregularities, asymmetries, and so forth. What is silicone injection removal with an open technique? Basically, removal with an open technique are for those patients who have a more severe case with very firm, hard areas, irregular areas such as like a baseball deformity or a golf ball. Yes, you can have things that big, deformities even projecting beyond into the skin and so forth. That's more appropriate to use a direct open approach to treat those patients. What happens inside the body when you inject it with silicone? Inside the body is reacting to help to prevent problems or complications. What happens, the body will help to wall it off, is trying to wall it off. And that includes scarification, granulomas, and so forth, and things like that. So the body's trying to protect itself, but this product can go beyond that and make it very, very difficult for the body's natural defenses to protect it, and then we have problems. Can you add fat to the buttocks after the silicone injection? You cannot add fat to the buttocks after the silicone injection. You have to wait and let everything settle, give it 6 months, and then you can do that, have a BBL. Will the buttocks look the same after removing silicone injections? It really depends upon the amount, and you gotta understand by removing it, you're also decreasing the butt, or decreasing the size of the butt. So we do want to know that and understand exactly how much the patient is willing to have us take down, but the goal is to still have a nice contour of the buttocks. We want to equalize the buttocks, we want to give the buttocks a nice contour. That's what the majority of patients want. How much silicone and fat are removed during the extraction? Well, it really depends upon the size. Normally we see that those patients with a very large butt, they want to normalize it. They want to get back to something similar to normal, or something similar that's going to bring the buttocks into alignment with the body. So it depends. I mean, remove 1 liter or 2 liters or 3 liters, or like a 2 liter Coca-Cola bottle. So it really does depend upon the size of the buttocks and the amount of product there. Are silicone injections lethal? Silicone injections can be lethal, especially if that product is injected into a vessel in the buttocks, and it can go and it can cause a heart attack, cause the heart to stop. It can cause what we call a pulmonary embolus as well. People can die from that. So it's a very, very dangerous situation, especially with these illegal injectors injecting this product. They know nothing about anatomy, nothing about the vascular system, and so forth. Are silicone injections legal? Silicone injections are not legal. They are completely 100% illegal. What's the difference between a biopolymer and a silicone injection? Again, a biopolymer is a legal substance. You have to be a doctor to acquire it. These products are FDA approved. Let's just say a biofiller is hyaluronic acid. Silicone, 100% illegal. That's it. What are the best alternatives for an augmentation? The best alternatives for an augmentation, obviously, is your own fat. If you don't have enough fat, you can consider a biopolymer, a legal biopolymer, such as Sculptra or Renuva.